तो ठीक है. Hi everyone and welcome at SONOMANTRA. Okay. So today's topic is yes, ectopic. Okay. And we will discuss yes how to go for A to Z. Okay. In ectopic. First of all, see, few points should be clear to you. Okay. What is the first point? That's okay. Usually, what is the first presentation? Any female presenting between 15 of age group 15 to 45 years, you should always suspect ectopic whenever she is complaining of pain abdomen. Whether so irrespective whether she is married, unmarried, whether she is even widow or having tubal ligation, things should be crystal clear. Any female presenting with pain lower abdomen, any female presenting with pain lower abdomen, if is having irregular menses, there may be irregular menses, but you should have a crystal clear picture. Yes, pain abdomen, history of amenorrhea or irregular bleeding. So first of all, get the UPT done. So when even the patient is unmarried, whatever the marital status is, any female 15 to 45 years, you have to be ready, and have ectopic in mind, with always do UPT first, so that it will be able to it will guide you whether so don't rely on the history first, go for the UPT. If UPT is positive, then always think of ectopic. Then second thing is that pain mostly pain is out of the proportion than bleeding is slightly less, pain is more, that is first. Amenorrhea, yes, definitely history of amenorrhea should be there, but you may get history of irregular bleeding also. And sometimes even the I am so I have covered and posted many cases of ectopic, and now today I am posting a you can say rare case of the ectopic. Rare in the sense then now this is the first case I am showing you. This female is 30 years female, and she has two cesareans previous. So she has two kids, and 30 years female. She has just and if you go by the history of her LMP was last menses were on 20th September, and she presented on 23rd of this October. She suddenly felt unconscious. She suddenly unconscious. And what is the and no history of pain. So no history of pain. She suddenly became unconscious, and I am showing you the presentation. She went to one doctor. And I don't know UPT was done or not. So that doctor done the transabdominal and TVS, and hemorrhagic cyst and the small fibroid was given. But patient was not satisfied. And some operative procedure was advised, but that patient was not satisfied. Then she went to the second doctor. That doctor also done TVS. And advised and given the report of a tubal pregnancy, unruptured tubal pregnancy. Patient was definitely not satisfied, and she went to third doctor, and the third doctor also written that it's curate tubal pregnancy. So this was the clinical picture, and the last two doctors they have done the UPT, and the UPT was positive. And in this way, in this case, the history was surprising. No pain abdomen, and she was having off and on mild bleeding since 15 days. Since 8th October. Now let me show you. And this patient came to me on 27th of this month. 2 days back. So let me show you what is the clinical picture, then we will discuss. See this. Yes. So see. So see, this is the TVS picture. So we should go for the transabdominal first. Okay, always suspect on transabdominal, then go to TVS. Okay, but in this, yes, there were so many doubts. Okay, previously, so I straightforward go to the TVS. Okay, now let me show you the TVS. Okay, yes, see this. So this is the TVS picture. See this. See, this is the anteverted uterus. If you see this. So endometrium, if you see carefully, endometrium, see this. Endometrial cavity, okay, is showing thin endometrium. Okay, so crystal clear that no signs of any intrauterine pregnancy. See this. No signs of any intrauterine pregnancy. Okay, and it is empty. And what are these? These are, see this. These are the see this. So it's clear that empty uterine cavity. Okay, is it clear? Okay, so and thin endometrium. What is the rule? Remember the rule. Okay, you will get so many mantras and rule today. Okay, in ectopic pregnancy, the endometrium usually less than 11 mm. E for ectopic, E for 11 mm. It's usually less than 11 mm, and it will be not much echogenic. Okay, you may get some free fluid. Okay, or pseudogestational sac. Okay, so no doubt. See this. So endometrium is clear cut. Okay, so see this. See this. Okay. Now let me show you. See this. One more. Okay. Yes, clip. See this. So thin strip endometrium, and if you want to measure, then you can measure it. See this. How it is. See this. Okay. See this. Simple. Measure in the longitude. Okay. See this. And it is longitudinal. What it is? It's only 6 mm. Okay. Now see this. What is there in the okay? Yes, all the doctors reported that it is in the left side. It is hemorrhagic cyst. Okay, let's see. Let's go to the left ovary. Okay, so this is endometrial cavity. See this, and see this. This ovary, left ovary is showing. See this, slightly complex. Okay, see this, typical of hemorrhagic cyst. Okay, so let me play the clip. See this. See this. It is showing typical hemorrhagic cyst. Okay. See this. Okay. Reticular pattern, fishnet. Okay. See this. See this. Okay. Typical reticular pattern of hemorrhagic cyst. Okay. Now let's go to the. See this. Now see this picture. Now I am going to the right thnx where the problem is. See this. If you see carefully, try to see this. Okay. If you see this, there is an slightly echogenic. See this, echogenic. Okay, round echogenic lesion. Okay, close to the right ovary. Okay, see this. Now see this. Okay, see this. We are saying, you see carefully, it is more echogenic. Try to see this. Its boundary. Okay, see this. It is echogenic, round, close to the right ovary. This is right ovary. Okay. Now what is the rule? You should keep on. Whenever you are doing any type of scanning. Okay, I am keep on repeating. You have to use SONOMANTRA scanning rules. What are the SONOMANTRA scanning rules? Simple. Okay, you have to decrease the scan area. See this is the scan area. You have to decrease the scan area as much as possible. Decrease the depth. Adjust the focus. Zoom the area. And after that, remember 4 P's. P4. First is the scan area. Okay. S. Second is the D, depth. Third is the fourth, SDF. Okay. Yes. Focus. Fourth is the zoom. Fifth is the 4 P's. What are the 4 P's? Change the probe. Always get 2 planes. Okay. First is the longitudinal, and the second is the sagittal. So 2 planes are must. Okay. And change the probe. If you are doing by convex, then change to the TVS. Okay. If it is if she is unmarried, then you should use linear probe also. Okay. So I'll always go for the higher resolution. Okay. After that, change the see this. What is the third P? 2 planes must. And what are the probe maneuvers? You should go for the P4 probe maneuvers and position. Okay. Go for whenever you are going for any adnexal lesion, you should go for the sliding test. Okay. I am going to that also. Okay. And one more thing, whether it is intraovarian or extraovarian, you should always go for the which sign? Big sign. Okay. So we are going to show you the demo of each. Whether it is intra-ovarian, what is the main issue? Okay, what is the main issue in that thnx? Remember, the main issue is the C. Whether it is intrauterine or extrauterine. Okay, we all know that ectopic is the most common C. Okay, so what is the most common position of the ectopic? What is the most common in ectopic is the tubal pregnancy. We all know. And in the tubal, which is most common? Ampullary. Okay, ovarian are very rare. Interstitial are very rare. That you should know. Okay. Now, what is the most common is the tubal ampullary. Okay, it will be close to the ovary. Now you have to slide your probe between the that tubal mass and the ovary. Okay, that is first. If there is a problem, is sometimes you see whenever you are going for the longitudinal scan. Okay, there will be sometimes problem. Okay, so what you have to do? You have to just turn your probe. Okay, just go to the transverse like this. Okay, see this. It's simple. If this is you are using. See this. If you are using your probe as a series, if it is you are going. This is the series. This is the mark, and this should be toward the roof. If this is the longitudinal, okay, see this. You have to just probe probe to the transverse. Okay, so your mark should be towards the roof, and you have to use both the transverse and the longitudinal. Okay, that is first. And now let me show you the sliding sign. Okay, see this. So what is the after applying all the Sonomantra scanning rule? Now see this picture. Okay, see this. Earlier was this picture with the full, see this, full scan area. Now see this. I have decreased the scan area. Okay, now see this. Try to see this, and what are the see this. You have one more thing. I will tell you. See this. In the nexa. Okay, you have to be very careful about two things. Okay, in the pelvis you should be very careful about bowel, gut loops, one. Okay, and we have to rule out one thing, whether it is intra-ovarian or extra-ovarian. Corpus luteum will be intra-ovarian, and the ectotubal mass will be extra-ovarian. Okay, so now let's go to the see this. Let me play the clip. Okay, see this. So this now I apply. Okay, slightly zoom picture, decrease the scan area. Now try to see this. Okay, these are the bowel loops with peristalsis. See this. Okay, food particles are moving. Okay, no doubt. So see this. Now if you see carefully, this is that tubal mass. Okay, see this. And this is the right ovary. Okay, see this. It is slightly, if you see this, it is, see this, try to see its echogenicity. It is more ecogenic, isn't it? It is more ecogenic. Okay, and this is the ovary. See this. We are able to see this ovary. See this. We can make out this. Okay, boundary of the clear. Okay, and this is the that tubal lesion. Okay, now see this. Now you can apply color and to show you the ring of fire, peripheral vascularity. But let me tell you one thing. Okay, ring of fire, people used to this sign. I never go for this sign. Okay, ectopic like appendicitis is grayscale and grayscale diagnosis always. Okay, so forget about even the corpus luteum will show peripheral ring of fire, or the and the tubal mass will show ring of fire. So don't use this sign. I am just showing you a demo just for the sake of the showing you that it will not give you any hint towards that diagnosis. Okay, see this. So don't see this. Don't give much value to this color. Okay, peripheral vascularity. Okay, see this now. Try to see this. What I am doing it. See this. I am just keeping my probe, and see this. This mass is moving. Okay, see this. Slide. You can see this. It will separate from this. Okay, this is the ovary. See this. You can check the. See this. You can check the hypoid line here. See this. Okay, all around this tubal mass. Okay. Now let me scroll it more. See this. Let me play it again once again. See this. This is very important. You have to see this. What you have. See this. Gut lobes freely moving, and if you see carefully, there is a hypoic line around this mass. See this tubal mass. See this. Okay. See this. See this carefully. Yes. See this. The fluid is going between this right ovary and this tubal mass. See this. So this hypoic. Okay. So, and if you see carefully, I will show you. Okay. Let the clip. You see this. Gut loops are moving. Okay. Freely moving. See this. Now if you see carefully, now I will show you the more details of this. Okay. Clip. See this, okay? So just wait for the, yes, peristalsis, bowel movement. See this. This mass is clearly outlined by, see this, mild fluid around it, okay? So there is a hypoic, see this, hypoic rim around, you can say, around this lesion, and it will, yes, it is making that it is separate from the ovary. So what is the yes, rule? You have to just keep calm. And one more thing, okay, you are doing TVS, okay, you are probably, okay, like, ask your attendant to push the maternal bladder, maternal abdomen, lower maternal, okay? When she will push, okay, what will happen? It will cause the movement of the gut loops, okay? So what my assistant was doing, okay, she has applied the abdominal pressure, okay? So see, these are the maneuvers you should, okay, yes, rule, you should practice, okay? So my assistant was pressing the abdomen, okay? What will happen? Gut loops will move, okay? And it will move that mass also, see, okay, again, see this, and I will show you, see this again, see this. See this, and again see, these are the bowel movements. See this mass now clearly separates from this right ovary, okay? And you can see the hypoic rim around this mass, okay? See this. And I will stop, okay? And I will go for the more details of this, see this. So just try to see what are the signs you have to look for, okay? See this. Now I will stop here and I will show you, see this. I will now see this. If you see carefully, there is, see, echogenic rim throughout, see, all around this lesion. Now see this. We will go more detail. See this, echogenic rim, boundary. Yes, throughout this mass, okay? Clear cut, making it a round. So what is this? See this, echogenic boundary, yeah, see this. You can clearly make out, see this, okay? And what is this? This is the blood collection. And this is the, yes, what is this echogenic boundary? Is the fallopian tube, okay? So what is this echogenic boundary? Is the fallopian tube. What, okay, so I am going how to define this, okay? So people keep on writing tube ovarian mass. So no, you should not never use tube ovarian mass. If you apply all these rules, you will be able to, okay, yes, so you will be able to clearly, okay, write whether it is tubal, ovarian, whether it is unruptured or ruptured, okay? So what I am doing was, I was applying the sliding, okay? Yes, sliding sign. Sliding sign means you have to slide your probe between the, yes, ovary and that tubal mass, yes, like this, okay? Whether sagittal or longitudinal, okay? It is as per the case. So go on applying this, okay? What will happen? If you are able to separate, okay, that from the right ovary, then it is, yes, clear cut tubal mass, okay? Now let me show you, okay? See this. And after that, go to the details of the, see this, details of this, okay? See this. So what it is, yes, okay, you can say what this heterogeneous lesion is the blood collection in the tube, and this, okay, echogenic yes, rim is the tube, okay? So that is an unruptured, okay? Now why? We have no free fluid, okay? I will show you lot of demos of the common presentation also, okay? So no free fluid was there, neither the patient was having any pain. So your ultrasound picture should correlate with your clinical picture, okay? Why this patient was now, let me, okay, so this is clearly, tube is, okay, well defined, okay, intact, and there is the blood, this heterogeneous mass is the blood collection in the tube. It means it is unruptured, yes, tubal pregnant, okay, ectopic. See this, okay, see this clearly. And one more thing, and okay, let me show you, okay, yes, go to the one more clip, see this. So let me tell you what is the, yes, see this, I will show you, okay. Yes, I will, let me, okay, see this. If you see carefully, there is a dip between, this is ovary, this is the, yes, tubal mass, there is a dip gap, you can say, okay, see this, okay, this is, yes, I will show you big sign, okay. Big sign means, okay, if there is any intraovarian lesion, what will happen? Suppose this is a corpus luteum, what will happen? It will, yes, okay, enlarge like this, okay. So the rest of the ovary will be big, you will see the beak, okay. I will show you the demo, okay. And if it is extra ovarian, see, this is an tubal lesion, this is my ovary, so this, okay, you will see like this, you will see this gap, okay. So this is revert, you can say reverse beak, but that definitely, see this, okay. So see this, okay. So there is a gap like this, and in intra-ovarian you will see beak sign, okay. I will show you a demo of the same, okay. So let me first discuss this case, and then I will, okay, go to the next case. See this, okay. Now what is one, yes, let's okay, let's finish this case, okay. So in this patient, neither the patient is having any free fluid, okay. Yes, no free fluid was in the, yes, POD, okay. Neither the patient is having any pain, neither any free fluid in the Morrison's pouch, okay. So that's why, yes, it is an unruptured tubal pregnancy of the right side, okay. Left side we are showing that it is, yes, crystal clear that it is hemorrhagic cyst, okay. So if you apply all these rules, okay, you will be, yes, so always apply sliding sign first, go for the beak sign, whether beak sign is present or not, okay. And okay, and when one, okay, see this, and yes, I have already shown you the demo of the, okay. Yes, try to see the more details of this, okay. Yes, tubal mass, and it will be more ecogenic. See this, try to see this, any ectopic mass, E for ectopic, E for ecogenic, and it will be equal to the ecogenicity of equal or more than, yes, endometrium. Ectopic mass ecogenicity, it will be more ecogenic, E for ectopic, E for 11, okay. It will, endometrium will be more than 11 mm, that is first, okay. Yeah, okay. First, what is the second is? Second is the ectopic mass will be more ecogenic because it is decidua. Definitely, we know that decidua is ecogenic, okay. So it is more ecogenic. Third is the, yes, it will, if free fluid is there, then that will be also ecogenic. So you should remember 3 E's. Turbid ecogenic, yes, free fluid in the POD. Endometrium should be less than 11 mm, and ectopic mass should be, yes, more ecogenic, okay. I will show you my demo of each, okay. So yes, so go like this, and yes, have a crystal clear picture of the, okay, ectopic, okay. Now this was the first case. Now let me show you the, yes, other cases. I have multiple cases for you, okay. So now see this. So what was my first rule? I was telling you, what is the first rule? Always, yes, go for transabdominal first, then go to TVS, and have a crystal clear picture of, yes, ectopic, okay. Now let me show you, okay. So start from the, yes, I usually do transabdominal in the, okay, on this machine, and TVS, yes, in this machine, okay. So you will see transabdominal pictures here and more TVS picture in that machine, okay. Now we will discuss. Let me show you, okay. See this. So this is, yes, one more case, okay. So like this, see this. Now this is the transabdominal picture. If you see carefully, this is the transabdominal picture. See this. We are saying, see this, anteverted, slightly retroflexed uterus, but anyhow, see this. What is the main thing you have to see? Okay, see this. Free fluid is there, okay. Yes, if you see carefully, let me see this. This ovary, yes, okay. Let us, if free fluid is there, if you see carefully, this ovary is not clearly outlined on, okay, on this side. See this. So, and this ovary is clear. Now see this. So always compare, okay. One more thing I keep on telling multiple times. Whenever you are doing a transabdominal, first of all, to take a transfer sweep like this, okay. So see this. You have to go for a transfer sweep, okay. Keep the midline and go from the pelvis, yes, and like this, and go to the fundus, okay, like this. And always compare and keep, whenever there is any adnexal lesion, okay, it will never happen that, yes, you will see bilateral ectopic, okay. It will be on right side or left side, okay. So always compare both the ovaries, both the adnexa, okay. Things will be very simple, okay. Now see this. See this. So like this. We are saying, okay, see this. This ovary is not outlined clearly, and we are saying some heterogeneous collection, okay, around this ovary. Mild free fluid is clear. This is the left ovary, and this is, okay, see this. This is well defined, okay, see this. If you see carefully, this ovary is not, okay, clearly, and there is a, yes, heterogeneous collection around this ovary, okay. And let me show you more, yes, one more picture. See this. So I am going from the, yes, pelvis to the fundus, and see this ovary. See this. Yes, and compare with the okay, on this side, this is my left side, this is right side. Okay, see this. This is not this ovary is not clearly outlined, and yes, see this. Always compare. Okay, so I am stopping it. See this. This is the left ovary. See, it is clearly outlined. You can see okay, almond shape. Okay, clearly with multiple small follicles. Now I am going to this side. See this. So we are saying okay, heterogeneous collection. Okay, all around this. Yes. Ovary. Okay, so we are saying yes, definitely yes, there is a heterogeneous collection, and if you see carefully, there is a free fluid. See this, there is a free fluid, okay, in the pelvis. Okay, yes, and yes, you see this free fluid with echoes, turbid free fluid. What I am keep on telling multiple times, yes, echogenic, that when it has echoes, then it, yes, fine echoes are there, it means it is turbid. Okay, see this, see slightly more echogenic, so turbid. Okay, and this ovary is not clearly, and we are seeing heterogeneous mass around, yes, collection around this ovary. So what it is blood collection around that ovary and giving us picture. Yes, what you people used to write tube ovarian mass. Okay, you can see on the transabdominal, you can, if patient is not, yes, going for the TVS, you can write tube ovarian mass, but always try to, yes, separate or categorize them. Okay, now I am going to the second case. Okay, I will discuss more. Now see this. Okay, have a more, okay, yes, clear picture. Yes, now see this again. Try, yes. So whenever, what is the first rule? Whenever you are seeing heterogeneous, yes, collection, hematoma, okay, yes, around that ovary, okay, and that ovary is not clearly, okay, yes, whether it is left or right, don't, okay, yes, see this. It is, yes, this ovary is not, okay, clearly outlined, and we are saying heterogeneous collection around this ovary, and see the location also, abnormal location, anterior to the uterus. Okay, so abnormal, yes, position of the ovary, collection, always, yes. So remember, abnormal ovary, yes, collection. Remember, it may be ectopic or it may be, yes, in yes, torsion also. Okay, so let me go to the, yes, see this. So we are saying, yes, heterogeneous collection anterior to the uterus. Okay, see this. Uterus is, yes, and ovary is, yes, slightly here. Free fluid is also there. Okay, again the echogenic turbid free fluid. Okay, so again, yes, see this. So heterogeneous collection around ovary with free fluid, yes, is giving us hint on transabdominal that it is, yes, most likely ectopic. Okay, now let me show you. See this. Now see the more details. See this. Free fluid is crystal clear. Echoes are there. Okay, see this. Yes, see this. Echoes are there. So echogenic turbid free fluid, heterogeneous mass around the ovary. Okay. Yes, always think of, see this. Try to just keep your prostate, okay, yes, stationary. See this. Yes, don't move, yes, and always look for the, yes, what I am looking for here, between the liver and the right kidney, it is Morrison's pouch. Okay, see this. Let me go to that. I will show you, okay, see this. Yes, see this. What it is, this is liver and this is right kidney. This is the mild free fluid. Okay, so whenever in doubt, just put your probe, okay, yes, longitudinally like this. Okay, and yes, you will see free fluid in the, yes, between the, in the Morrison's pouch, then always, yes, in favor of the, yes, because it is the most dependent part. Okay, so yes, fluid will, yes, easily collect here. Okay, so let see this, and let me, so see this. I am measuring that, yes, tube ovarian ugly mass. Okay, again see, it is, yes. And what is the 88.4? Okay, keep on, okay, see all these values. Okay, all these values have, yes, okay, great importance. If you apply all these, yes, one by one, things will be easy for you. Okay, now see this. Again, less than 11 mm. Okay, I am going to the next. Let me show you. See this. One more, yes, one more picture. Okay, see this. Don't rely, okay, immediately, okay, from transabdominal to TVS. You can use linear probe. Linear probe can also give you, yes, if patient is not willing for TVS, whether married, unmarried, okay, yes, definitely if it is, yes, if she is unmarried, definitely we have to use linear probe also. Now see this. Okay, you will see, yes, better resolution. Again, the heterogeneous mass with fluid, okay, now see this, with linear probe. Now see this. If you see carefully, this is the linear probe and try to see this, yes, see this again, try to define it, see this whirling pattern, okay. So you will able to see the clearly boundary of the tube. This is the tube and this is that, yes, heterogeneous mass. What is this? Heterogeneous is the, yes, ectopic. Yeah, see this, okay, see this. So just try to see this, try to see it is clearly, yes, round, okay. This is the tube and this is extended by this heterogeneous collection and this is that ectopic mass. Okay, try to see the ecogenicity. It is more ecogenic, equal or more than, yes, endometrium. Okay, so try to see all, apply all this. Okay, again it is ecogenic. And what will, yeah, what is this boundary? Is this, you can clearly outline. See this, try to see this. There is a, yes, differentiation. Okay, all this. Okay, so it is, yes, tubal. Okay, see this, and it was not clear by the, yes, trans abdominal convex probes. Now see this, okay. If you can see this, you can see the, yes, small, yes, sac-like structure in that, okay, lesion also, okay. Now let's go to the third case, okay, one more case, live ectopic. Very good. Whenever you are seeing the live ectopic, okay, so let me go to the, yes, yes. So whenever you are seeing fetal pole, cardiac activity, okay, in the, yes, ectopic mass, then definitely, yes, there should be no doubt. Okay, that is, it is 100%, okay, yes, ectopic. Now let me show you that also. Okay, see this, see this, see this. Again the thin endometrium, no free fluid also. Okay, so thin endometrium, I am going to the, yes, this is TVS. Okay, now I am going to the, yes, in the adnexa. See in the adnexa, free fluid I am seeing. Again, see, try to see each and everything. It is more ecogenic. Okay, tubal mass more ecogenic. See this again, more ecogenic. So what is the formula? Ecogenic, it will, rim will be more ecogenic. See this, okay, yes, more ecogenic. Try to go for the, okay, see this, fetal pole is there, you can see. Okay, now I will apply again Sonomantra scanning rules. Okay, things will be more, see this. Okay, again see, it will be, yes, let's have a zoom picture. So this is the ovary, see this, this is the tubal mass, and if you see carefully, we are seeing this, okay, fetal pole, yolk, see this, fetal pole, yolk sac, you are able to see it. Okay, let me show you, see this. Okay, now let me go to one more zoom picture. Now see this, we are seeing this, see this tubal, see tubal ring, and this is the fetal pole. Oh yes, see this fetal pole and the yolk sac. Okay, yolk sac, fetal pole. Okay, so and showing the cardiac activity. Okay, see this, so it is live ectopic. Okay, yes, so live tubal, yes, ectopic. Okay, now see this. Okay, and what is the, see this, we are seeing fetal, okay, fetal pole, cardiac activity, yolk sac. Okay, you can measure them. Okay, and cardiac activity is there. Okay, see this. Now let's go to the third picture. See this. So always, yes, try to separate this tubal mass from the, yes, ovary. Okay, by sliding sign. See this, what I am doing this, I am keeping my, okay, I am, yes, I am withdrawing my probe. See what I have to apply the sliding sign. Okay, just withdraw your probe back. Okay, then slide. Okay, see this, see this, what I am trying to separate this tubal mass, tubal ectopic mass from the ovary. I am sliding my probe. Okay, see this. So again, this is the same picture. So this is that, see this, this is that tubal ectopic mass and this is the ovary. Okay, see this, see this again, see this. So this is how you should apply. Okay, see this. Free fluid is also there, definitely free fluid is there. Okay, yeah, see this. Okay, so, or when one more thing. Okay, so whenever you are saying, yes, cardiac activity, fetal pole, okay, yolk sac, then it is definitely ectopic. Okay, so no doubt at all. Okay, now let me show you one more picture. Now let's go to one more case. See, okay, yes. So keep on applying all these. Just see this. What I am showing you the free fluid. Okay, see this heterogeneous mass in the pelvis. Okay, and free fluid. Again, see the this is the liver, right kidney, free fluid in the Morrison's pouch, and this is the heterogeneous lesion. Okay, now let's go to the see the again the heterogeneous mass collection in the pelvis. And when I am going to the Morrison's pouch between the liver and the right kidney, I am seeing fluid collection. This ecogenic strip. See this anechoic strip. What it is? Fluid collection in the Morrison's pouch. Okay. So now see this. See this. Okay. See this. This is the fluid collection between the liver and the right kidney, and it is the most Now see this. Whenever you are seeing this, always think of ectopic. Okay, and get the UPT done. See this. So there is a fluid collection, and now one more thing. Just see this. What will happen? Okay, sometimes blood clots are there. Okay, when you are seeing heterogeneous mass clearly, then it's very simple. Okay, but sometimes what will happen? You may see blood clots. Okay, or irregularly outline mass. Okay, so try to differentiate it from the bowel. Okay, now let me show you that also. Okay, see this. So what I was telling you, how to do, you will do that. You have to look for the peristalsis. Okay, yes. So just keep your probe, okay, don't move, and you will be able to appreciate the peristalsis. Okay, see this. Now let me show you. Again, the heterogeneous mass is there. Okay, see this. See this again. Heterogeneous mass, okay, in the pelvis, fluid collection. Okay, let me go to the see this. Heterogeneous mass, free fluid, ovary cannot be outlined. Yes, let's go to again. See the fluid, ecogenic, turbid free fluid, isn't it? See this ecogenic, and it is dense because it is blood. Why it is more ecogenic and turbid? Because it is blood. Okay, yes. So always whenever you are see this, whenever you are seeing irregular, sometimes you miss. Okay, see this. Now this is typically if it is more ecogenic and moving, okay, and showing peristalsis, then it is bowel. Okay, yes. So see this. Let me play it. Okay, you will be see this. So whenever you are seeing ecos, dense, turbid, free fluid, then it is blood, hemoperitoneum. Okay, yes. So it is. Let me go to and now let me show you the see this. Let's show the linear. Now this is linear. Okay, linear probe, linear scanning. See this. You will be able to see the more details of that heterogeneous. Try to see this. Okay, clearly heterogeneous mass against the what you will see, try to see the boundary, ecogenic rim. Okay, so what it is? Yes, it is tube. Okay, and this is the heterogeneous collection. Okay, yes. So whenever you are seeing free fluid and blood collection, okay, and that mass is not clearly outlined. Okay, if the mass is not clearly outlined, blood collection in the pelvis, then most likely it is ruptured. Okay, so and patient will patient will have pain out of the proportion. Okay. See this. Okay, see this. So this is the with the linear probe. Okay, now I will show you more TVS pictures. Okay, see this. So so let's see more. Okay, more cases of the again let me show you. See this. So this is the series. Okay, what is the ET? 10.92. Okay, less than 11 mm. Okay, and again the see this. Again the free ecogenic turbid fluid. Okay, and irregularly outline. You see this irregular defined ecogenic mass. So there may be blood. Okay, let me show you. See this. So let me see this. I am showing that. So see this. This is endometrial cavity. Okay, empty endometrial cavity. Okay, see this. So sometimes you may see this irregularly. Okay, ecogenic tissues around. Okay, yes, around the ovary. Okay, so see this. So what is these are blood clots, okay? See this. And try to differentiate them. What are these? These are the, yes, let me show you again. What are these? See this. So what are these? What these are the bowel loops. See this. These are the bowel loops with peristalsis. Let me go to that again. Okay, see this. So I am showing you that this is the endometrium. Okay, clearly see this. Only slightly thickened endometrium. It is empty. Okay. Now I am seeing the free fluid. And what are these? These are irregular ecogenic. See this. Around the ovary. These are the blood clots. Okay. Try to differentiate it from the bowel loops. Okay, these are the bowel loops. They will show gut signature. Gut signature means alternating pattern of the, yes, slightly thickened ecogenic wall, and alternating pattern, yes, more ecogenic and hypoic pattern of the, yes, gut loops. We call them gut signature. Okay, see this. And these are the what? See this. Try to see this. Okay, these ecogenic blood clots will not show the, yes, peristalsis. Okay, see this. And these, yes, see, you can see the food particles inside the bowel loops. Okay, so these are the, this is the one. See this again, that, yes, ecogenic turbid fluid in the, okay, yes, ecogenic and turbid free fluid. Let me show you. Okay, yes, see this again. See this again. Empty endometrial cavity, less than 11 mm, ecogenic turbid free fluid. Okay, and again the heterogeneous, yes, mass. Okay, yes, heterogeneous collection around the, yes, ovary. UPT was positive. Okay, all these are giving, this is the ovary. See this, you can see this. This is the ovary. See this, this is the ovary, and there is a heterogeneous, this is the ovary, there is a heterogeneous mass. See this collection, or see this, this is the, that was the other ovary. So always compare. See, this is the normal ovary. Now I am going back to the, see this, see this. So always compare. Okay, see this, this is the, yes, one ovary, and if you see there is a collection, yes, heterogeneous collection around this ovary. Okay, these are blood clots, and this is, this ecogenic turbid is the, yes, turbid fluid is the hemoperitoneum. Okay, see this. What are these? These are the blood clots. Okay, so always try to differentiate them from the bowel loops by peristalsis. Okay, so whenever you are saying yes, ecogenic heterogeneous mass around the ovary with ecogenic, yes, turbid free fluid, and yes, empty endometrial cavity with UPT positive. Okay, pain, patient will be having pain. Always think of, yes, ectopic. Okay, ruptured ectopic. Now let me show you, yes, one more common presentation, and then we will discuss how to differentiate between them. Yes, corpus luteum. Okay, see again. This is the transabdominal picture. I am seeing, okay, I am seeing the free fluid and this heterogeneous collection around this ovary. Yes, so yes, heterogeneous, mainly ecogenic. Now this, if you see carefully, yes, again the hemorrhagic cyst. Okay, in this ovary. So whenever you are saying heterogeneous, mainly ecogenic, again I will again repeat, heterogeneous, mainly ecogenic mass around the ovary, ecogenic turbid free fluid, and yeah, see this, and this is the fluid around the, again see this, again see, let me, okay, empty endometrial cavity, again empty endometrial cavity, yes, ET less than 11 mm. Okay, yes, heterogeneous mass, mainly ecogenic around this ovary. Okay, free fluid, yes, will be more ecogenic and turbid free fluid. This ovary is showing, okay, this, yes, see this hemorrhagic cyst, follicle, no issue, just measure them. Okay, so this okay, and what in the, yeah, see this again. So what are, in the last we are saying that there is a fluid collection between the liver and the right kidney, and this is the Morrison's pouch. Okay, so fluid in the Morrison's pouch, UPT was positive. Okay, so it is clear, crystal clear. Yes, tubal ectopic. Okay, when you are clearly seeing the ovary, okay, if margins of the ovary are crystal clear, then it is, yes, yes, take it granted that it is tubal pregnancy. Okay, so this is the common presentation. Now we will discuss how to differentiate it from corpus luteum. Very important point. Okay, so let's first revise. Yes, what are the points you should remember, whether it is corpus luteum or tubal mass. So what is the first point? The corpus luteum is intra-ovarian, tubal mass will be extra-ovarian, okay? So if it is corpus luteum, you will see big sign. If it is tubal ectopic mass, you will not sign big sign, you will see reverse big sign, okay? You can say the gap will be there, okay? And you will be able to see, okay? When it is, yes, corpus luteum, okay, sliding test will be negative. You will not able to separate that corpus luteum from the ovary because it is intra-ovarian. But sliding test will be positive in a tubal mass because yes, you can separate when it is yes tubal, okay, ectopic, okay, from the or right ovary, okay, from right or left, so doesn't matter. So you will be yes, sliding test will be positive when it is yes, when it is tubal ectopic pregnancy, but when it is corpus luteum, sliding test will be negative, okay. Now we will see it, okay, how to differentiate and how to use the big sign also, okay. So yes, it is you will see the demo of the same, okay. See this again, see this, okay. Let me show you again, see this. So this is again, okay, heterogeneous mainly ecogenic mass around the ovary, heterogeneous mainly ecogenic mass around the yes ovary. So we are suspecting, see this carefully, this is the ovary clearly outlined and we are seeing this ecogenic mass, okay. So ecogenic, heterogeneous, mainly ecogenic mass around the ovary, think of ectopic, okay, yes. So this is the first rule. ET less than 11 mm, thin, empty, endometrial cavity, empty, ET less than 11 mm, it may, yes, endometrial cavity may show some, okay, free fluid, okay. Now let's see this. We are seeing ecogenic mass around, okay, around this right ovary. You can use the color, but again I am telling you, yes, you should not give much, okay, this much value, this ring of fire, okay, is of no value. Always apply. Now see this, there is a mild free fluid. This is TVS picture. Now see this, this is this TVS picture. We are seeing some free fluid. See this. We are seeing some free fluid, okay. So what is the yes, okay, you may in ectopic in ectopic you may see a free fluid and pseudo gestational sac. So how to differentiate free fluid and pseudo gestational sac from true gestational sac? True gestational sac will be, okay, slightly eccentric means it will not be in the midline, okay, see this. So just try to follow the endometrial cavity. It will be slightly, okay, pregnancy, yes. True sac will be slightly, yes, eccentric means slightly away from the midline, and free fluid and pseudo-gestational sac will be in the midline. Now see this, I am following try to follow this endometrial cavity, I am following this endometrial cavity, this is in the central, okay, see this. So it is the central, okay, just a fluid collection or maybe pseudo-gestational sac, don't worry, okay, see this. So it is central, it in the midline. This is, see, you can measure this endometrium, and this is the clearly central. Okay, what will happen in the, yes, try to, okay, see this on daily basis. Ectopic, yes, usual gestational sac as usually slightly away from the midline. We call them eccentric, okay, yes. And here it is central fluid collection or it, okay. Sometimes, okay, pseudo-gestational sac will be also give the same picture. So don't give, okay, just remember whether it is central or okay, eccentric. Now see this, okay. Now let me show you. Let's go to the, yes, in next. Now see this. We are seeing, just see this. And well, yes, round, see this. Okay, ovary. And what is the characteristic of this mass? See this. It is, yes, hypoic, okay. Hypoic, less ecogenic. See this. And what is this? Yes, mass. It is more ecogenic. Okay. You are seeing both the corpus luteum. See this. This is the corpus luteum. It is hypoic. Okay. It is slightly black. Hypoic. See this. Dark, slightly dark. Okay. And if you see compare, and it is the ovary. See this. It is the small follicles. See this. These small follicles in the periphery. This is ovary. And see this. What this is hypoic. Okay. Yes, now I am showing you I will show you now let me show you see this. Now see this tubal mass, see this, it is more ecogenic, okay. So ectopic mass will be more ecogenic, see this. It E for ectopic mass, E for more ecogenic, see this. What it is in the center, you may see sac-like structure, okay. So it may be gestational sac, see this. So tubal mass, more ecogenic, yes, ectopic mass, more ecogenic, it may contain sac or not. Okay, it is not necessary that it may always contain sac. In this case, it is showing a sac-like structure. Okay, so it may be just a sac. Okay, now see this. So just try to see. So just try to see all these features. Okay, and again see. So what is this? Ectopic mass will be more ecogenic. Okay. And okay, it is not necessary that you may see sac, okay, in every patient. Okay, see this. So what, how to differentiate? Corpus luteum, hypoechoic. See this, it will be also thick. Okay, see this. But it is hypoechoic, okay, slightly black. Okay, and this tubal mass, ectopic tubal mass is more ecogenic or it is containing, see this. So like this. So it is more ecogenic. Simple. Always compare side by side. So see, whenever you want to see the ecogenicity, so don't use much chroma. Okay, you will be, yes, try to get pure grayscale picture. Okay, always compare the, yes, chroma you will not able to differentiate. Get a grayscale picture, always compare side by side. Okay, you can side by side compare in this way, simple, yes, or just scroll back like this. See this, okay, this is hypoic and see this is ecogenic. So this is the tubal, yes, ectopic tubal mass, and this is, yes, corpus luteum. Now what is the, yes, in this case it is just clearly okay, away, so there was no doubt. Okay, so now let me show you one more picture and yes, things will be more clear. See this. So yeah, again the hypoic, okay, we have already discussed this. I will measure the, yes, tubal mass. Okay, and on that side, see this, you can measure the, yes, this sac-like structure as a gestation sac also can give. Okay, okay, and how to measure the ET? Whenever there is a fluid, okay, measure both anterior, posterior like this in two parts and add them. So it is again 3 point, see this, again around 9. So it is again less than 9, yes, 11 mm. So always apply, keep on applying all these rules. Okay, in each patient, this is this, what I am trying to do, sliding sign. I am sliding my probe between this tubal mass and the ovary, and they are clearly away. See this. So see this. So it is clearly separate from the ovary. So it is definitely tubal ectopic mass. Okay. Now what is the beak sign I was telling you? See this. This is the corpus luteum. The rest of the ovary will be compressed and will form a beak. I have shown you with the, I am showing you with the arrow. See this. This is the beak sign. Okay, this is the corpus luteum. Let me show you how I get it. See this. This is the corpus luteum. I am following it. See this. So this is very important. Try to just appreciate how I get that image. Okay, I am showing you. See this. It's simple. This is the ovary. See this. I will scroll back. Okay, scroll back. I will show you that also. Okay, let me go to that video. See this. See this. See this. What is this? This is the ovary. This is the ovary, and here this is the corpus luteum. This is the rest of the ovary with follicles is compressed, and this is the beak. Okay, so this is the beak sign I was telling you. You have to see any, yes, any, okay, whether it is intraovarian. Basically what will happen, it is showing you that that structure is arising from that organ. Okay, not see the corpus luteum, ovary, corpus luteum will, yes, will be intraovarian. What will happen, it will grow. The rest of the ovary will be compressed. Okay, compress हो जाएगा. Okay, और beak बनाएगा. Okay, like this, bird's beak. Okay, so see this, it is beak like, that's why it is called beak sign. So it is, and giving you a hint towards that whenever you are seeing beak sign, it means it is intraovarian, or it is, yes, whenever you are seeing intraovarian, then it is, yes, corpus luteum. Now I will tell you one more thing. Okay, suppose in this case we are, yes, we are saying, okay, forget this case, we are saying a tubal yes, ectopic mass outside extraovarian. Definitely it is tubal ectopic pregnancy. Suppose there is a, yes, ectopic maybe, yes, intraovarian also. Okay, ovarian also, definitely we call them ovarian ectopic. So how to differentiate? from whether it is corpus luteum or ovarian ectopic mass, again apply the same rule. In that case, you will be not you apply the your sliding sign, because that is ovarian ectopic is also in the ovary, and the corpus luteum will be in the ovary. How you will differentiate? You can differentiate by the ecogenicity. Again, remember our ecogenicity. Tubal ectopic mass will be ecogenic, whether it is extrauterine or intrauterine. So ovarian ectopic will be mass will be more ecogenic. Okay. So see this. In this it is hypoic. What if it is ecogenic? Okay. Yes, and you are seeing no other adnexal lesion around the ovary, and it is ecogenic. Again, try to apply the same feature, free fluid. Try to if you are seeing no other adnexal lesion, okay, no, like in this case we are seeing this. If we are not seeing this, and we are seeing the lesion in the ovary is ecogenic, free fluid in the POD, okay, UPT was positive, empty endouterine cavity. So again, this may be in favor of ectopic. Okay, so ovarian ectopics are very rare, but whenever it is ecogenic, always keep in mind the ectopic pregnancy. Okay, so they are rare, but they may you may get such a case. Okay, so this is the big sign, okay, suggestive of intraovarian corpus luteum. Okay, so that was about how to differentiate the corpus luteum and the ectopic mass by the ecogenicity and the sliding sign and the big sign. So remember three things: ecogenicity, sliding sign, and the big sign. Okay, now I will show you one more case. Ectopic with dermoid. Okay, so let's see this case also. Okay, so sometimes you may get this case. Okay, so it is not, I will say common picture. See this, we are seeing this ovary, we are seeing this ecogenic mass. See this. So whenever you are seeing any ecogenic structure in the ovary, always think of dermoid. It is ecogenic mass, not giving any shadowing. So any ecogenic mass in the ovary without shadowing, think of dermoid. Okay, see this. So this is the endometrial cavity, empty, again 14 mm. So again, sometimes you may break the rule. Okay, see this. It is 14 mm. What is the ecogenic mass size? 15 into 16. So it is derma. Okay, now see this. Crystal clear ecogenic mass. Now let me show you. Okay, so we are seeing the empty endometrial cavity. See this ecogenic lesion in the ovary and small peripheral follicles in the ovary. So it is dermoid. Okay, so any ecogenic lesion in the ovary, see this. So it's very otherwise dermoids are usually complete. Involve whole of the ovary, and here it is occupying a small space. Okay, now see this. So it is an empty endometrial cavity. Now see this. We will go to the see this. This is the I am showing you the first ovary. One ovary. Now we will go to the always compare. Okay, you will see how whether it is doing transabdominal or TVS. Always compare both the ovaries. Okay, whether you see this. Now if you see carefully, see this. There is a let me go back. See this. There is a see this. There is some slightly, see this. There is some ecogenic mass. See this. Isn't it ecogenic, round ecogenic mass around this ovary? Okay, now let me show you the color picture. So I am applying again the color. Okay, it will not take color, definitely dermoids usually are avascular. So now see this. Again see this. Again keep on applying all the rules. Decrease the scan area, decrease the depth, adjust the focus. Now see this. Again the ecogenic tubal. See this, round ecogenic with a sac-like structure. So again see the ecogenicity. Okay, round ecogenic sac. Okay, showing sac-like structure. So what it is? It is tubal ectopic mass. Okay, so it may contain a sac. You may see a sac-like structure. So that is not compulsory. Okay, but we are saying so it is in more favor. Okay, what is the more important is the ecogenicity. Okay, try to say this. What I am keep on. stressing from the beginning, just try to see this ecogenicity. Okay, you may see a sac-like structure, so it is not necessary whether you see sac, fetal pole, cardiac activity or not. Okay, they are not necessary for making the diagnosis of ectopic. What is the most important? That when any adnexal lesion which is ecogenic, okay, UPT positive in the clinical scenario, see this. Whenever you are seeing sac-like structure, then it is in more favor. But try to say this ecogenicity, round, apply round, and again, if you see carefully, again see this ecogenic rim. Okay, so what it is? This is the tubal. Okay, this is the tube. Okay, fallopian tube. Okay, see this. This is the fallopian tube. This is the blood collection in the sac around this. So this is the tubal mass. Okay, distending this. Okay, tube. Now let me show you. See this. So again, this is the ovary with dermoid, and this is the So just try to never confuse it. Okay, see this. So sometimes it may be confusing, but again repeating. Keep common things common first. So common knowledge is very uncommon, but anyhow, but you have to remember, keep the common things first. Okay, so any ecogenic lesion in the ovary, dermoid, any ecogenic lesion in the adnexa, tubal, ectopic. Okay, see this. So this is easily, and you can easily separate them. You can apply the color. Again, I will say color is of not much value. It will not give any, because we have already make the diagnosis of ectopic. Okay, you will see the peripheral vascularity. Okay, just to show you. Okay, the peripheral vascularity. Okay, and you can measure the that, and you can consider it a gestational sac. Okay, now see this. Always try to see this. What I am doing, I am keeping my probe transverse. Okay, that's why you are seeing fundus and the adnexa in one view. So always see this. Just have a clear picture. I am seeing the uterus. Where will the this is the uterus. Where should be my tube? My tube should be on the both side, and then after that ovary. So if you are doing longitudinal scan, you will not able to get all in one picture. So what you have to do? You keep your probe transverse. Usually people are not in a habit of doing changing the probe transverse. Okay, they may think that it may be painful to the patient, but it's very simple. Just keep when you can keep the probe longitudinal, just turn your probe the transverse like this. Okay, and slide. Okay, when you do this, now what is the value? Okay, so when you do this, you will get when your probe is transverse. Okay, you will get both the fundus of the uterus and the ovary in one line. Okay, like this. See this. So this is the fundus, this is the ovary. Okay, yes. So what is this my scan? I am keeping my probe transverse. Okay, so this is the fundus, this is the tube. Okay, tube area. See this. Simple. Tube. See this. Uterine fundus, tube. Okay, ectopic tubal mass, and the other is the ovary. Okay, so like this. So have crystal clear picture. Okay, fundus and empty endometrial cavity. Okay, this is the ovary, and again this is the tubal ectopic mass. Okay, not much free fluid, so it is most likely again unruptured. Okay, so like this. Okay, so it was ectopic with dermoid. Now I will show you. Yes, so sometimes let me, only two cases are there. Okay, let's good. Okay, now so one more thing. Okay, so sometimes free fluid, if it is not ecogenic. Okay, so remember, I am showing you a case. You may get so whenever you are seeing free fluid, but it is not ecogenic. Okay, and uterus is also endometrial cavity is also empty. Okay, patient is having bleeding. Okay, and sometimes it may you should be you should think of all possibilities. What happened? Pregnancy was intrauterine. Okay, patient keep on bleeding. Okay, so abortion was in progress. Okay, and when the patient reported to you, you are saying that it is an empty endometrial cavity. Okay, not much. Okay, some few RPOCs may be there. Okay, you may not able to appreciate, but you are seeing free fluid in the pelvis. So it is not necessary that, but try to see the nature of the free fluid, whether it is ecogenic or not. Okay, And if you are seeing any cyst, specially again repeating, okay, simple cyst, I am showing you as okay case somebody has given it an ectopic, okay, but it was not ectopic. Now let's see this. Okay, now let's see this. And also UPT was weak positive. Now see this. Okay, some free fluid was also there. Let me show you. Okay, see this. Okay, yes. So some free fluid was also there. Okay, yes. See this empty yes, cavity. Free fluid was there. Okay, free fluid was there. Empty endometrial and yes, empty endometrial cavity. See this. Okay. Yes. See this. Bowel. Yes. With gut lobes with peristalsis. Try to appreciate each and everything. Okay. Just be patient. Okay. Give some time for for peristalsis. Yes. And this is the ovarian cyst I was telling you. Okay. Now let me show you again. See the more details. This is the ovary, free fluid. Okay, I am not seeing any heterogeneous mass. Yes, and see this ovary and free fluid. Okay, it is not much echogenic. Okay, so and we are seeing empty endometrial cavity. Okay, let me show you the one more picture. See this. So ovary, yes, fluid was not turbid. Almost clear. Okay, see the ovary, no heterogeneous collection, okay, around the ovary, and this is the ovarian cyst. Okay, see this is the large ovarian cyst. Okay, ovarian cyst is there. Okay, so that fluid is clear, not echogenic. So it may happen. Okay, so you should now keep in mind, see this fluid is clear, not echogenic. Okay, so what I see this, some echos are there, but not much dense. Okay, see this, and no heterogeneous collection. You can say very well defined heterogeneous collection. Okay, beware of all these. Okay, bowel with peristalsis. Okay, just give some time and you will see the peristalsis. Okay, so when the fluid is not much echogenic, okay, and empty, and see this again see this, but if you see carefully, try to see this. Okay, see this empty endometrial cavity is there, but it is slightly echogenic. Okay, so sometimes if patient keep on bleeding, so you may not get RPOC. Okay, always. Okay, you may get such a picture from fluid may be there, so you can go you can go for the beta HCG. Okay, it can go for the beta HCG, or you have to follow such patients. Usually, this patient was clinically stable. Okay, was having just mild pain. Okay, and not much pain. So always give value to the clinical picture of the patient. Okay, whether the patient is stable or not. Okay, if patient is having more symptoms, then you can go for the beta HCG. If there is a doubt, or if the patient is stable, just follow it. Okay, simple. And let me show you what are the other things. Okay, so this is the free fluid, and so in this area there was because some previously doctor has advised, as reported that it is a ectopic. Okay, so I just follow it and patient settled. Okay, so no issue, it was only intrauterine. Okay, now let me show you one more picture. So sometimes you may get such a picture also. Okay, now I will show you. So I showed you the first case. Okay, in the beginning I showed you the first case, that was a unruptured ectopic pregnancy. Okay, in that case I was giving you the history. That patient suddenly became unconscious. Okay, and nobody was there. Okay, she was having only 2 kids. Okay, her husband was not there. Okay, so and in this patient, no pain was there. Now I am showing you one more case, of unruptured ectopic pregnancy. Okay, unruptured, usually the ruptured ectopic pregnancies are more common than unruptured. Okay, so when you will say ruptured or non-ruptured, if you are saying free fluid, then it is most likely ruptured. If you are not saying free fluid, then it is most likely unruptured. Now let me show you one more case. Okay, see this. I am now this is the transabdominal picture. Okay, this is the uterus, this is the, yes, see this, one ovary, and what is the, see this is the uterus, empty, see this, empty uterus, ovary, and if you see carefully, there is a heterogeneous mass, see this, heterogeneous mass, okay, here, this is the ovary, and this is that heterogeneous mass, isn't it? See this heterogeneous mass, okay, see this, large heterogeneous mass, okay, see this, mainly ecogenic, okay, see this, large heterogeneous mass, clearly outlined. If you see this, it is, yes, round, okay, and this is the ovary. And now let me show you the color picture. I have applied the color just to show you the peripheral vascularity, ring of fire. Now I am showing the transabdominal picture. This is the transabdominal picture. This is the uterus, empty uterus, okay, empty, yes, endometrial cavity, yes, endometrial cavity, and this is, see this, again the large round ecogenic mass separate from the ovary. This is the ovary, and yes, almond round, well defined with peripheral follicles, and it is separate from this, yes, mass. And now if again see, what is this? See this, now you have to again go for this, try to see this, it is more ecogenic, okay, keep on applying our simple 3 E's, it is more ecogenic, see this, heterogeneous, more ecogenic, okay. And what is this? Ecogenic rim. What is this? See this, try to see, this is boundary, it is, yes, this ecogenic collection is, okay, this hypoic, try to say this hypoic rim around the, yes, lesion, okay, so it is tube, okay, and this blood collection has distended this, yes, tube, so it is hematosalpinx, blood collection in the tube, okay, so it is large blood collection, yes, tubal mass, okay, so it is large blood collection in this tube, okay, see this, try to say this hypoic rim, okay, all around this ecogenic, so it is blood collection in the, yes, in the tube, yes, you may call it hematosalpinx, okay, but it is basically, yes, tubal mass, okay. Let me show you the, okay, this is the first clip, okay, now see this again, see this, okay, so it is clearly empty, yes, empty endometrial cavity, ovary, and again see the, yes, see this, okay, clearly outlined, yes, clearly outlined, yeah, ectopic mass, okay. Now I, okay, when you have empty endometrial cavity, ovary is separate, okay, let me show you again, see this, this is the tubal mass, okay, clear. Just try to see its characters, more ecogenic, try to see the, yes, outline, okay, the tube is this ecogenic, yes, slightly hypoic is the tube boundary, okay, fallopian tube, so try to see this, it is crystal clear, okay, why it is, okay, why it is confined, it is confined by this tube margin, okay, margin of this tube, okay, see this, so try to appreciate, okay, you will be able to see this, it is ecogenic and it is slightly hypoic, okay, this boundary is slightly hypoic because it is the boundary of the tube, okay, so it is unruptured tubal ectopic, okay, it has not ruptured, that's why we are not seeing much free fluid, see this again, see this, okay, so it is unruptured, okay. Now let me show you again, you can apply the color again, the I keep on repeating, color is of not much value, not, okay, and not give much importance. I am now measuring it, simple, what is the ET? 7.6, okay, so keep remember the rule, ET will be less than 11 mm, okay, I am measuring the mass, okay, and I, okay, see this again, the, okay, again what I am you see this, why I am seeing the fundus and the tubal mass in one line, because my probe is the transverse, just remember, keep on applying all these rules, okay. So besides the longitudinal, the sagittal, just run your probe transverse and you will be, yes, see, you will be easily see the its origin, see this, we are seeing a large mass near the fundus because this is the location of the tube, okay, see this, so that's why, yes, you are seeing this, okay, so that is, okay, unruptured tubal mass, okay, yes, to make all the hematosalpinx also blood collection in the tube, okay, but yes, it is tubal ectopic mass separate from the ovary, okay, yes, clearly outlined. Okay, and let me just, so it is, yeah, see this, so its location, shape, ecogenicity, closeness to the fundus. Okay, you can apply, okay, you can separate this from the ovary by the sliding sign. Okay, so this is how you should differentiate, and let me show you the one more case. Okay, common presentation we have already covered. Okay, okay, one more thing. Okay, sometimes people, oh yeah, okay, may confuse, though I have no okay, people may confuse, okay, trivial mass with hydrosulfings. Okay, I can show you one more case. It's simple. Okay, okay, let's complete. So it's very simple. Okay, the one more common, okay, lesion, I will say, yes, in the adnexa is the, yes, fluid collection in the tube, hydrosulfings. We call them hydrosulfings. Let's see this case of these, okay, cases also. So there is a, yes, copper in the endometrial cavity. Okay, so see this. Now I am going to the, okay, I have applied the sonometric scanning rules. Decrease the scan area. Okay, so I am seeing the, okay, see this, copper T, okay, in situ, no issue at all. Now let's see the, okay, show you the, yeah, see this. This is the ovary. We are seeing this, see this, cystic, okay, see this, cystic, tubular, see this, with incomplete septa. Cystic, tubular, with incomplete septa, see this, incomplete septa. So it's always suggestive of, yes, hydrosulfings. Again repeat, let me, yes, see this again. So just see, when you are saying, okay, yes, see this, yes, see this cystic, tubular cystic structure with incomplete septas around the ovary. So think of hydrosulfings. Okay, so think of hydrosulfings. So let me show you that this is the TBS picture. Again see this, you are saying, yeah, see this, cystic, tubular cystic lesion. Okay, tubular cystic lesion with incomplete septas. Just try to see these incomplete septas. Okay, around the ovary. See this. So these are, yes, what are these? These are, this is, yes, distended tube hydrosulfings. You can apply the color, it will not take color. Okay, simple. Again see the, yes. So if you are seeing, yeah, cystic, tubular cystic lesion with incomplete septas around the ovaries, think of, yes, see this, try to see this, these are incomplete septas. Again, whenever you are seeing this, keep on applying, yes, both the, yeah, keep the, okay, sagittal and transverse to see the septas. Okay, otherwise you will not see the, yes, incomplete septas. So you have to keep SONOMANTRA scanning rules in mind. Okay, and my, yes, 7 SONOMANTRA scanning rules should be on your tapes. You are, okay, so you are doing any type of this is the other ovary, well defined with peripheral small follicles. Okay, so always compare. Now see this. Okay, so we are seeing this, yeah, cystic tubular structure with incomplete septas. Again, my probe is the transverse. What is the location? This is the fundus, this is the ovary, this is the tube location. Just keep on applying. See how beautifully we are able to see, because I am seeing the fundus, tube and the ovary in one view. You can just see this. So get a crystal clear picture. How to use, what is the location, fundus, tube and the ovary. Just turn your probe. You cannot get this view in the longitudinal. You have to turn your probe transverse to get this view. Okay, see this, fundus, okay, of the uterus. See this. So all these things should be in your, yes, reflexes. See this. Okay, see this. This is the ovary. This is the, my, yeah, cystic tubular with complete septa. Classic picture of hydrosulfings. Okay, this is the classic picture of hydrosulfings. Okay, so these are the, yes, let me again see, fundus, tube, okay, incomplete septas. This is the ovary. Okay, so okay, this is I'm measuring, okay, in 3 dimensions. Okay, you can apply the color to differentiate whether it is taking color or not. It will not take color to, yes, usually do not take. Okay, so we usually do not see the, okay, fallopian tubes. We usually see the fallopian tube, okay, only and only when it is dilated, okay, or by fluid or by, yes, ectopic mass, okay, yes, ectopic mass and the collection, okay. So, blood collection, let me show you. So hydrosalpinx PCOD, okay, I think we have covered all our cases, okay. So I have one more class okay, after 1 hour. So how to so what is the crux of the class? Crux of the class is that, now let me tell you few stories also, okay, and before concluding, okay. a widow came to me, and yes, she was complaining of pain lower abdomen, okay, and she came with her 14, okay, year son with her, okay, and I suspect a heterogeneous, yes, collection lesion around one ovary, okay. Then I suspect, okay, ectopic, okay. I advise UPT, okay, and yes, and UPT was, yes, faintly positive. I did the TVS, okay, and I was sure that it is, yes, mass separate from the ovary, so it is tubal mass, or okay, so some separate from the ovary, and it was again menses, yes, menstrual history was very irregular, okay. She said that she was saying that her menses are off and on since 1 month, okay, and but you, okay, so the picture, ultrasound picture was, yes, typical of yes ectopic, okay, and UPT was faint positive, okay. Then I, yes, counseled that lady, okay, when sitting her son outside the OPD, okay, and yes, then she shared that she is widow, okay. So I counseled her that it is, you have to tell me the, yes, correct story, okay. Then then finally she admitted that she has, yes, relations, okay. So I keep on repeating, and one more case, okay, a unmarried female was there, yes, suddenly reported, okay, with yes, tubal mass, and her attendants were not, okay, even the yes, digest the diagnosis, but UPT was positive, okay, and it was a ruptured pregnancy, okay. So again keep on repeating, whether any female from 15 to 45, whether married or unmarried, widow, or even the, yes, one case was after 8 years of ligation, okay. So you should not give any, yes, importance to all these. Any female with pain lower abdomen, suspected adnexal lesion, always go for UPT, okay. It's just 10 to 20 rupees strip. So even if you are not having an hospital type of setup, you can keep them, okay. So just to get your diagnosis, yes, correct each time, okay, on every patient, okay. You will not face any, yes, all these litigations, okay. Otherwise, yes, in the earlier patient, okay, patient, yes, reported that some doctor is saying it is ectopic, some is saying that it is not, okay. So have a crystal clear picture, okay. Ectopic is a diagnosis you can't afford to miss. You should be crystal clear, and you apply all these, yes, SONOMANTRA scanning rules, all these, yes, signs and symptoms, okay. You will never miss any ectopic, okay. So again repeating, ultrasound, ectopic, yes, diagnosis of ectopic is clean, yes, grayscale and grayscale. First do the transabdominal, then, yes, if patient is, yes, unmarried, you can use linear probe, okay, then go to the TVS, okay. Try to use both sliding sign, big sign, try to differentiate, okay, by all these mantras I have just told you, okay. So I think, yes, that's all about the ectopic, okay. Yes, I have given 2 or 3 demos, okay, already on the ectopic, I think, okay. So that's all about, so yes, about today's masterclass. One more thing, I am keep on, yes, seeing so many messages about that, yes, about how our course at the SONOMANTRA goes, okay. So let me tell you that also, okay. So we are, yes, having just 10 courses, okay. SONOMANTRA Golden Fetal Medicine and SONOMANTRA General Medicine course. Okay, in SONOMANTRA Golden Fetal Medicine course, we are having first trimester, level 2, obs Doppler, fetal echo, okay, and gynae and infertility. Okay, they are coming in the SONOMANTRA Golden Fetal Medicine package, and they are the best for the gynecs or those who are involving only in the obs and gynae, ultrasound, those who are doing general abdomen, small parts, vascular, musculoskeletal, and echo also. For them, okay, we have SONOMANTRA General Medicine, okay, course, okay. So you are most welcome. Those interested in the SONOMANTRA courses are most welcome. And let me tell you one more thing, okay. So this is the I am just telling you how our course goes as the SONOMANTRA, okay. So we have cases and presentation like this. Any topic, any thing which is not clear to my students, they can ask me, and okay, they can message me in my WhatsApp group, okay. We have WhatsApp groups of all these and Facebook groups of all these, okay. So yes, and we have also we have also launched our SONOMANTRA app also. So okay, so it's very simple. All the once you join the course, all the previous master classes like this, okay, you will be able to get them. You can just see any lecture, any time, any number of time, okay, and as per your convenience, okay. So it's very simple platform. And what is the one more unique, okay, USP of our SONOMANTRA is that, yes, just whenever you are in problem, during daytime or off time, it doesn't matter, just store the clip, okay, or yes, if you have an emergency, just give us a WhatsApp video call, okay, show us the video, okay, give us the clinical detail and show us the ultrasound picture and the videos. We will help you in making the diagnosis on the spot, okay. And yes, my members have this opportunity and they are availing this. And one more thing I want to tell you, that what about the Zoom classes? We have our SONOMANTRA Zoom master classes. In the Zoom master classes, I usually select a topic, okay, and I usually start from the normal, okay, what is the normal in this, of that organ, or what is the topic, okay. I describe the normal, how to, now like this we are covering the fetal echo. So I start from the normal fetal echo, what are the normal views, okay, you have to learn, okay, and know, okay, and how to get them on each patient every time, okay. Yes, and after that, we go on discussing all the anomalies, whether 4 chamber, 3 vessel view, all views, okay. So all type of heart anomalies we are discussing, okay. And after that I show, okay, show them cases, okay, abnormal cases. And what is the best part that I allow my students or my members, that you have to answer on my personal WhatsApp number, note in the chat box during our Zoom master classes, okay, so that they can apply themselves, okay, and they should not copy from others, okay. And once you apply, okay, yourself in this manner, you will develop reflexes, and the same reflexes you will have when you will scan the patient, okay, during your daytime, and you will get the confidence also, okay, once you are involved in this process, okay. So see, every learning, every training is has a learning curve. Learning curve means it will take time. So that is the unique, that's why that is the unique, you can say USP of ours, and that's why their name SONOMANTRA Ultrasound Trainer and Coach. People usually ask me, okay, sir, will I be able to get the do the scan like you? Or so I keep on telling, it's not challenge to you, it's challenge to me that I can teach ultrasound online, and I will keep on trying multiple times till you all are expert and master in this. And my many students are performing very well, and I am very happy, okay, on daily basis. They keep on asking the questions. More questions you ask, more you will clear your doubts, okay, and you will get the confidence, okay, of doing the scanning, okay. And just see, and we discuss not only just okay, there is some light issue anyhow. I think, okay, it's okay. Anyhow, so what I was telling you, I was telling you that so you should get the confidence. How you will get the confidence? See, you have seen Dhoni, skipping of Dhoni. What he usually do? See this. He keeps the ball. He gather the ball and just throw the ball to the wickets. He never look at the wickets. But what is the what he has experience, he has so many experience, he has so many calculations that okay, that when I will pick the ball and where I will throw the wicket. Okay, so you should have a crystal clear picture of all these things. Get trained yourself. Okay, get all your doubts clear. How to do a scan. Okay, if somebody is doing something, you can do the same only and only if you know how to do that. Okay, for that, yes, you should know all the tips, tricks and mantras for the same, and that is our USP. So that's all about. Hope you would like the presentation. Thanks for watching. Those interested in Sonomantra courses are most welcome. My next masterclass is planned at 8:30. So those interested in our Sonomantra classes are most welcome. My number is already displayed in the group. You can WhatsApp me on my number. And for the course detail, I will help you in guiding all. So that's all about. Hope you would like the presentation. Thanks for watching.